So here's the start of my lecture. I wanted to talk a bit about virtual orthodontics. It's a new paradigm, and it's a shift. And I wanted to talk to you about why I have shifted my practice from your traditional braces and fixed appliances to go to digital orthodontics and customized appliances and now virtual. I want to just acknowledge my family. Sorry, my husband's photo was here, has disappeared. I don't know. Thank God she's not here. He's picking up my sister-in-law who's just flying in from US. She booked her flight to arrive at the time I'm lecturing. We didn't know. Anyways, I'd like to acknowledge my mom in memory of my mom and my beautiful dog, who are my guiding angels, and my brother, who I love teaching everything. He believes I teach him nothing, but look, there's photos of me teaching him what an apple is, what an eggplant is. So I've been a natural teacher. So I am very inspired by this saying, when you learn, teach, when you get, give. This is kind of my motto. Everybody's phone's up. You can scan this QR code. You can download the handouts of this lecture today. You can also download a lot of my recent published articles, all in the field of digital orthodontics and virtual orthodontics, including some newsletters. So there's a lot of downloads here. If you can't scan the code, just take a photo. You can go to that URL, qrcode.de/pubs. Okay? Feel free to take as many photos of the slides. Just quickly about me, I am Vandana Katyal. I'm an orthodontist. Does anyone not know? I've done my dentistry in 2001, so I am old. I'm not that young, actually. I know I look young, good genes. I've done a Master of Science in Medicine, Clinical Epidemiology from the University of Sydney. Then I went on to do my orthodontics in 2013 in Adelaide. Subsequently, I did lots of research at Dusseldorf in Germany. I was there months. I started learning German. At one point, I was going to have a German husband. Came back to Sydney. Sydney pulled me back. And finally, I did an MBA from University of Canberra. It was the most fantastic degree. I did it 100% online. It taught me the value of online learning. After my MBA, I went to Stanford University. I highly recommend it. I did the Innovation Design Thinking Bootcamp. It's 4 days of madness, but you are in touch with some of the top CEOs of the world. I mean, this thing costs a bomb. You could buy a house with the money you spend from those 4 days. Or put a deposit for it, but it was fantastic. It opened my mind to how to make real differences. So I really recommend anybody who wants to go to the Design Thinking Bootcamp at Stanford. They do everything really well. So back to my lecture. Some of you might be thinking, what's digital orthodontics, what's virtual orthodontics? So I thought I'd put a little bit of definitions here. Well, digital ortho is simply any customized appliance planned digitally. From digital record taking to digital planning. I call it digital orthodontics. By the way, no one's really coined this definition. Maybe I should put Katyal's definition of digital orthodontics. What's virtual orthodontics? Well, it's at this point in time, what we understand is providing virtual orthodontic care. So an app like dental monitoring, and nowadays you have Invisalign app as well for tracking and monitoring. What it does is converts your digital treatments that you've planned and delivered with tracking and applications that help you really do real-time measurements and tracking. Now, it may have artificial intelligence embedded on it or not. So some of them are automated, some are semi-automated, some are fully not automated at all. Essentially, all of them are trying to do this. While your patient's in treatment, they're asking them with a mobile phone to submit a video of how their teeth are looking, how their bite's going as they're progressing through orthodontics. And it can also be used for patients with braces. So why is this becoming such a new way of doing things and becoming so popular? Well, I think the story goes back to some of my cases, and why it's really popular with me and my patients as well. This is a case we're going to talk about later on, where I simply gave this kid aligners and treated him really well. It turned out beautifully with aligners alone. Back then, we didn't have dental monitoring or virtual tracking. And then this is my very first teen patient where we combined the aligners and did virtual tracking. And what I was blown away was with how amazing it was, not only for the treatment result, treatment speed, treatment tracking, but also as a doctor experience and patient experience. Since then, I changed my models. And not only I've been intraoral scanning since 2015, back then labs didn't even know how to accept STL files. We never actually bought alginate in 2015 when I started my practice, which was unheard of back then. To 2016, I started virtual tracking, probably on the East Coast, some of the first orthodontists who did the first virtual tracking case. But then I evolved. 2020 pandemic. We had patients who really wanted treatments, and we couldn't even assess them. So we started virtual appointments where we could actually show them just from a simple photo within minutes, generate with this AI how their teeth are going to look if they were aligned. And this is just fantastic. And we were able to communicate with them, engage, educate. So when we were able to, meet again in person, the patient was ready to start. So we didn't want to waste our time. What I thought all these technology gave me is an extra pair of eyes. I was able to see beyond. It didn't replace me. It doesn't replace the doctor. It just gives you an extra set of eyes, which I love to have. So our journey today, we're going to go over some evidence, some cases, and I'm going to go over some final takeaway next steps at the end. Let's start with evidence, right? Hopefully, there's a few slides of braces, sorry. I don't know if any of you know this is back to basics, okay? Some of you may be doing orthodontics, some may not. But we know that Andrews gave us 6 keys to normal occlusion. Andrew only looked at a few hundred patients on study models. And based on that, all these appliances are made. The braces, the pre-adjusted appliances are made on that. But here's the problem. All of these appliances are based on ideal orthodontic appliance, having no slop, having no fail mechanism. And they're based on ideal force delivery, and might I add, ideal response, tissue response to orthodontic forces. Well, we know that's not true, okay? Because we know the same force in similar dogs can create different rate of tooth movements. Hence, biological variation is huge amongst humans. It's the biggest thing. So these simple theories of forces and moments and braces don't apply anymore because one size does not fit all. And in my opinion, it's the silliest thing I've heard. So I decided to make my appliances more proactive, more dynamic. And ever since then, I've just written from newsletters to articles to opinions and published papers. So again, when you download this QR code, you'll be able to download these. These are short little articles that I've written why, virtual orthodontics and AI-driven systems are so cool. Not only that, I published in AJODO a paper where we compared 50 cases treated with Invisalign alone and 50 cases with dental monitoring and Invisalign, so virtual and digital. And we looked at the differences in those 50 patients post-treatment. It was a fantastic study. I'm very proud. Professor Nicholas Schwed has been a dear friend of mine, the guy on the last author. He's always the last author. And he supported me so much in all my endeavors. And he's the current WFO president. And I wish he was here because I did invite him, but I know the distances are huge for him. Then recently I also wrote an article about artificial intelligence-driven remote monitoring. And I co-authored with several other authors there. I also published for my boss students, only exclusive, by the way, is that handbook, okay? But soon to be out in Amazon as well. So I'm writing a book called The Clinical Handbook of Digital Orthodontics, something that I didn't have when I started all of this. And recently, just very recently, I published the first paper on virtual first, meaning the patient, before even seeing you in the chair, is submitting virtual consultation, virtual photographs, and how you engage, what kind of workflows you use, what kind of technology you use. It was a clinical applicable paper more than a study, and it's just been published as well, again, for you to download. And what I show is how amazing this virtual first technology is. So virtual first is a term I coined. where patients do not come in your chair unless they've done a virtual appointment, because what I want is them educated. I want my patient educated, engaged before they come and see me. It's a fantastic tool where I can show them even before they come in, just from a simple photograph they submit, how are they going to look like with braces? How are they going to look like with the aligners? How are they going to look like with attachments and aligners? So this is the patient seeing all these different simulations simply within 2 minutes of submitting a photograph. Fantastic. Technology is here, okay? And you can really use it to engage and utilize your patients. So the tool here that I use is SmileMate. I've done over 600 virtual consultations with it, and I've never looked back. In fact, patients don't get booked in my book unless they've submitted this. The only time I don't do this is when they're children. This is more applicable to adults. What I also realize is my patients are very busy. They're busier than I am. I cannot ever get them on the times that I want to get them. Holidays, they always got school, after-school activities, and patients want their appointments being done right from, comfort of the beach or their home. So by using these technologies, I was able to offer them that alternative. You might say, hey, what about, do patients actually really like this? Well, patients do find it more convenient. This is a fantastic Australian study. It had about 80 subjects where they were surveyed. So patients find this kind of technology more convenient, and definitely the reduction in clinical appointments is seen as a positive. But you know what's good for me? I'd love to have the least risk of complaints and disputes, and recording more, taking more virtual records. It just helps me do that. I can see when recession's developing. I can see when compliance is becoming an issue. It is just so fantastic. It's a tool we never had before. Also, patients feel that we communicate better, that they communicate better with the orthodontist when they were being virtually tracked. And seeing the orthodontist less. Isn't that interesting? You're communicating better while you're seeing them less. I also think, go back to Snoop Dogg, thanks to me, I also have to think about me. What if, the great resignation's upon us? I know many people have walked out of their offices, and I wanted to create a virtual office for me, to give me a break as well, because I'll tell you, this is from my MBA, this research, happiest people use money to buy time. Okay? Because time-poor people often are driven with anxiety, depression, and stress. So I like to buy back time, and I like to just rock and roll from my home, like Brad Pitt, and and have a good time treating my patients while being safe and predictable. So how come we're doing all this? Well, we know technology is rising. We have Apple Watch on our wrist now. We're heading into the 4th industrial revolution, which is actually all driven by artificial intelligence. All this data that's being collected is actually now being harnessed and analyzed, and we're getting, AI-driven systems from those databases. Now, I'm not saying they're perfect yet, but they're getting pretty close. The more data that's fed, the more analysis done, the better they get. We also have population changes where, we know Australian population, the I generation, the Z generation on the rise. Wi-Fi is the new black. Everything is wireless. We don't even connect anymore. There's cable-free things. Not only it's affecting humans, there's Z generation puppies now. This is a cute little puppy. I call him iPad puppy. So it's spreading to the animal kingdom. Many advances have been made in orthodontics, 3D imaging, we know very well, biomodulation, which is about accelerating tooth movement, smart and customized appliances like things like Invisalign, digitally planned systems, Insignia from Ormco, and AI automations, which is really, I think, is the best thing. But here's the problem. There are smart and customized appliances like SureSmile. Now, SureSmile does robotically bent wires, but really, papers don't show a big difference in using this, okay? And again, the chief author of all SureSmile papers is the inventor himself. I really love this appliance myself, Insignia. There's customized brackets and wires. It's made by Omco. Really slick system from practice management point of view. But again, here's the problem. It's never been shown to be any superior to conventional braces. So a lot of these customized fixed appliances haven't really come out in studies to show that they're better than conventional. So I believe customized orthodontics with clear aligner trumps, whether it's Invisalign, Spark, it really trumps. Because demand for clear aligners is huge. You know, it's really huge. It's the patients driving this, so we need to learn to get good at this. We know patients prefer aligners over braces in many studies. Not only that, we know that aligners are fairly predictable for certain movements, but there are problems. They're not as predictable in certain movements. The accuracies are low for incisor root torque, for premolar derotation, but really high for upper molar distalization. Almost bodily, we can move an upper molar and distalize it. Extrusion is also a bit problematic with aligners. But that's because, you know, you can't just give everybody the same pill and expect the same results. So if we just give everybody 7-day changes, here you go, we can't expect that because it's not proactive. There's no real-time adaptation to that human biologic variation that exists. Where is that variation coming from? Osteoclast, osteoblasts, right? How bone remodels, we go down to the cellular level. Because teeth don't know a magic appliance or a bracket or a plastic. Teeth know osteoclasts and osteoblasts, and they react to the responses. The cellular response is the key here. So unless we can stimulate cellular response, there is no magic appliance. So what I believe is what the combination of digital and virtual ortho does is try to get closer to that gap of removing the human variation by allowing patients to only change aligners depending on the speed of their own tooth movement. There's many advantages. I believe it's semi-automated, so I don't have to wake up in the middle of the night when patient submits a scan. They can get an auto response. I troubleshoot things early with my patients. I've reduced my case revisions, reduced treatment time and chair time, yet to be proven in trials. It's controversial. Some studies are showing slight reduction in treatment time, others aren't. But chair time, every study shows about 35 to 40% reduction in chair time. Reduced litigations, again, no evidence on that yet. But it's just common sense. The more data you collect, the more you know, the more protected you are. We know that number of appointments are reduced. We're doing virtual orthodontics by nearly 40%. Refinement slightly reduced, so we don't have to do as many revisions for the patient. And treatment time slightly reduced in the retrospective study. So my study was the same. So this is my study that got published and also presented as a poster. We found very similar results to the previous study, both on Australian populations, and both completely different practitioners. And, I didn't even know. And we had the same team, but we kind of had very different goals and databases. So we're finding the same results. We're finding that we're getting there with more predictability, with less clinical appointments and happier patients. So what I love about the virtual orthodontic monitoring, the new paradigm, the new shift, is that I'm tracking failures as they occur. I'm tracking non-compliance as they occur. And it's just a fantastic doctor experience. I can sleep at night knowing everything is slick, okay? Because I care about my patients. This is my nephew. I only saw him 3 times for his RME because it's hard treating family. But dental monitoring allowed me to do that because I put his expander. He had to turn. We opened the diastema. We're doing skeletal expansion. Does he have to come in? Nah, don't worry. Just submit your scan. I'll just see you virtually, And then he comes in because he cried a lot when I put it on. I didn't want to see him again. And then I say, okay, oh yeah, that's good. That diastema is good, very good. Keep turning, keep turning. No, don't need to come in, don't need to come in. Okay, come in now at 6 months, come in. We're going to remove the expander. And throughout that experience, every week he's submitting scans of his diastema opening and closing. I could measure, look at his tooth 1-6, how much it moved buccally just from a virtual upload, okay? No x-rays required, no study models, no in-chair visit. Look at his tooth 6. So tooth 6 had also moved buccally by about 2 millimeters. So I know I got about 4 millimeter of expansion approximately, some tooth, some skeletal, a combination of it. So it's just fantastic. I just love it, especially those anxious patients. Now, I also learn a lot from this system because here I'm looking at this case, looking slick, aligners fit well, teeth are moving, it's an extraction case. Extraction cases are difficult with aligners, but everything's going really well. The teeth are moving bodily, I'm happy, but one tooth's not moving well, and it teaches me, hey, you didn't put an attachment on it. You're moving that tooth bodily so much. So I can stop and revise as I please, and I can just bring the patient back. I love the messaging tools too. They're more sophisticated now, where you can do like auto responses and, send all your patients a joke of the day as a group message through these apps. It's really cool. Let's get into cases. We understand everything. Let's look at my very first case of aligner, teen aligner that I treated. I remember just saying to him, I don't think aligners can do this. I don't think so. We'll try. We might have to put braces on. We never had virtual tracking back then. We're talking 2015. 15-year-old kid, class 2. We know he's a bit older. His growth is nearing the end. We can't do growth modification. Possibly class 2 correction has to come with surgery if he wants facial change. But, we decide, okay, let's go ahead. Let's do some treatment. We can do deep bite. It's a challenging case, actually, for a 15-year-old. So we've got deep bite in a class 2. So we're obviously using a combination of anterior intrusion, posterior and posterior extrusion, hoping some growth is left. A lot of dental alveolar changes, more than skeletal. And we're just, hoping that aligners can deliver this. And back then, they weren't as sophisticated as they are today. And we do get there, actually. You can see this is his almost nearing the end scan. The deep bite's nearly corrected. We are 26 months in treatment. We're almost finished. And what I love is the retention. 12 months in retention, he's coming back looking really fantastic. Smile, incisal smile display still really well maintained. And some occlusal settlings happen. And this is his facial change. Now, I didn't do anything. Growth. I love watching growth. I love taking these photographs because I go, how can a class 2 elastic bring the chin forward? It was his growth. So he still had some growth left. Predicting growth is an art and a science, actually, in orthodontics. It's very difficult to do. So let's go to the one that changed everything for me. So this is an aligner case, class 2, div 2, teen, similar to the other guy, just a bit younger. And we decided to try virtual tracking. And I wanted to monitor him week by week. He had to submit his scans as he's changing his aligner, so I knew what was going on. And we can see here that, we were able, this is his initial photos, quite severe overbite and quite a severe class 2. And we use class 2 elastics and aligners with virtual tracking. Boom, 6 months. I'm going, whoa. Patient says, can I get a refund? You said 2 to 3 years. I said, oh. We're nearly done, so I changed my consent form. If I finish treatment earlier, no refund given now after this case. Because it's just, and you know what? It was growth, biologic response. Look at the response between this kid and that kid. That kid took 26 months to correct deep bite. He's, boom, 6 months, done. Okay? So here we are, 11 months. I'm just going, what do I do now? How did we get here? Well, the key is, we've learned to overcompensate. We know extrusion's not very good with the liner, so we kind of build overcompensations. We're extruding his molars, almost like heavy contacts at the end, because we know it doesn't work. So one key message I'll give you, take a photo of this slide if you want, is that aligner data is all based on adults, by the way. We don't have much data on teens. And aligner data tells me deep bite correction is very difficult with aligners. Yet case after case after case, I see magical deep bite corrections. So what is happening here? Well, I think we don't have data on teens. Growth. Growth is the biggest predictor here. So what I love about the monitoring, I was able to see his class 2 canine become class 1. How nice. I can sleep at night. He's wearing his elastics. Woo. This is like fun for ortho, yeah? Seeing it all go to class 1. But, it's also fantastic for those advanced cases. This is a case I'm going to show is published in this recent paper. And this is an extraction case with aligners who didn't want surgery. Quite a challenging case also because she was living between UK and Australia. That didn't make it easy. And we basically had to remove 4 premolars and do some sort of retraction mechanics for her. And she was submitting these scans all the way from UK all the time, and we're kind of measuring her progress as she comes to Australia every few months. what we're seeing is this nice bodily walking of that premolar, that lower right premolar, how beautifully it's going into the extraction space. It's almost like, salsa dancing, it's like opera. I don't know what it is. It's just like watching this was like, wow, there's been no loss of anchorage. This is going beautifully, and I could sleep at night knowing she's in the UK. Everything is going well. We've got 13 months progress. We can see how beautifully the premolars have retracted, almost bodily. Now we just got to bring the incisors back, which actually aligners are very good at. A big tip, very good at bringing things back. Very difficult to bring things forward. This is her scan. She submits from UK, and we're like, oh, I think you're done. When you're going to come here, we're finishing you. It was nice for me to be prepared. We knew what to do. We finished her treatment, a really beautiful result for her. Her incisal display didn't become worse with open bite cases. It can. And I always say symmetry is beauty. Even if you show a lot of gum, but if you show symmetrical, is beauty. So that's my perspective anyways. So I was able to deliver orthodontics to suit someone's lifestyle who lives between countries, monitor from overseas, and continue to monitor her gingival health. This is Jack Lee, Novo Creative, my marketing guy. Jack Lee came with an open bite, didn't think it was ever possible to do without surgery. And Jack Lee is looking fantastic today. Jad Clark will be next. And he was the most compliant patient I've ever met, actually, and it was fantastic having a marketing guy do treatments because he knew how to market you after that. It was just great. He knew. He's like, oh, we don't talk about this with your patients. We don't talk about that. I said, oh, Jack, put that down on the website. Do it. Let's do it. This is Jack's before and after video. Fantastic. So really, Align is great at open bite closures, but you want to track them very closely. Again, a great learning platform for me to see how it all went so quickly. Even advanced, really severe. This is a transposition of canine. No braces were used, no TADs. By the way, I don't like screwing and hammering. So I'm not a big TAD fan because I think TADs are unnecessary in many, many, many clinical applications. There's only maybe 5% of the times I would use TADs. Anyways, a very difficult case, completely rotated lateral incisor, completely transposed canine. And, this is his very first scan in my chair. He's submitting his virtual upload so we can track him. The first one is important. We can now track him. It superimposes each photo and wraps it around. Fantastic technology. We're able to finish him. Now, it did take quite a while for this guy, okay? But it is a very tough case. A transposition of canine with 4 premolar extraction, and it did take three years or so, I think, to finish him, just over 3. So we've gone from here to there, and not one missed scan by this guy. I mean, I don't see non-compliance. People say, what about non-compliance? I don't see it. If you have a personal trainer, right, you're going to go attend that appointment. You're going to work out. Okay, I give them a personal trainer. That's what I'm doing. I'm saying you got to scan. Okay, it's going to keep them. And they love these videos because they can see it in the app. Now, I'm not selling any system here. I have no interest in any system, but I'm showing you a really slick way of doing things. So how do you start orthodontic treatments and start virtual orthodontics and do this magical stuff? Well, you got to educate yourself. You've got to get the right mentors. The team is important, and you've got to have a growth mindset. Back to basics, if I can leave you with something today, is never forget profits, giving us the most basic things. The biggest question I get asked all the time, is this possible? Is this movement possible? Can we move something 1 millimeter? Can we do this? And I say, just please look at your profit book. This, take a screenshot, gives you an idea of what you can achieve with orthodontics, what you can't achieve with orthodontics, and you need surgery with it, or you need skeletal anchorage. Okay, it gives you if you're going to retract incisors more than, for example, 7 millimeters, I think you need more than orthodontics alone. So Profit's given us the basics, the guidelines, how much we can move teeth with orthodontics alone, right? We're not magicians. So how much is that limit of tooth movement? It's very, very good. So when somebody even wants to understand case complexity, this is where I go to. And this is another one of my favorite slides for the upper molar. Okay, so you can, again, take pictures of it, and you can download it. It's in your handout. Finally, I want to end with boss. BOSS delivers accredited, Australian accredited and UK accredited diploma. I'm very proud of achieving that. It's taken a long time to get here and a lot of battles, and we got here. We are a registered training organization in Australia. We are an edu.au, and it's just fantastic. But I know diploma is not for everyone. So I know that we also deliver CPD courses, short CPD courses for people. I'm not a big fan of short CPD courses, but for those, who just wanted some background knowledge, it's fine. I've graduated many people. Some of them are amongst this room. And I'm very proud to say I'm developing a boss army. It's a boss army. Just yesterday, I was very emotional, a day before, one of my students sends me this reel, and I just wanted to share with you because I believe with BOSS what we created is a platform where people can have flexibility in their lives, which I think sometimes universities miss out on, this flexibility, this support, while still addressing the needs of the general dentist in education. I want to just share this with you. It's a very emotional video. Isn't that cute? Apparently, the kid's running around saying, "Did you see the kid was little when she started the diploma, and then he grows up and he's running around with the trophy?" A mother who was on maternity leave was able to educate herself because of this online platform. I really think that is magical. When I got this video, I nearly cried, and I thought how amazing I was able to empower a woman while she was on maternity leave and didn't want to take a step back in her career while having kids. And she had this platform, and she got an achievement, and her son's carrying this trophy around, and he's grown up. So it was so beautiful. It came as a complete surprise to me. I didn't know she was filming her moments over the diploma, and she sends this, and it made every effort, every sacrifice so worthwhile. So one tip I'll give you guys, I have a YouTube channel. It's got hundreds of videos from cases to how-to, even scientific lectures. If you don't want to do any courses, that YouTube is an amazing source of information. I know some of my videos are very highly reviewed and liked. So you can easily follow our YouTube channel. It's at Boss Ortho. And you can basically subscribe when we put new videos. Again, don't forget, all the downloads of this lecture are here, plus bonus articles. Like the Olympics, winter and summer, we want to be back. We want to be back in 2025. We want a year rest, and we want to be back and bigger. So stay updated on our Insta, follow Boss Ortho or Simply the Best 2023, and we'll keep updating you once we launch 2025, and hopefully it'll be at this same venue. Thank you, Sydney. Thank you, all of you. Thank you to my presenters, to the entire team, and thank you for listening to me.